the Caregiver Connection podcast by Best Care, where we dive into new topics each week, drawing inspiration from our insightful and educational blog posts. We're committed to providing valuable information that impacts both home care clients and caregivers. Without further ado, let's jump into this week's episode. Are veterans eligible for home care services? At Best Care, we have immense respect and gratitude for the sacrifices made by our veterans, active service members, and their families. As a result, many family caregivers we work with provide home care for veterans. Many of our veterans returning from conflict carry visible and invisible wounds. Post-traumatic stress disorder and traumatic brain injuries are two types of disorders that many veterans must deal with for the rest of their lives. Managing these conditions can drastically alter a person's life and family relationships. As a result, families often find themselves asking, how much does the VA pay for in-home care? And do veterans' benefits cover in-home care so they can ensure their loved one gets the help they need? We will summarize what's available, but for more detailed information on VA benefits, please visit the Veterans Administration Home Care Benefits website. Veterans Administration benefits. Under the VA Mission Act of 2018, veterans are eligible for more comprehensive health care services, including home care. The VA's Comprehensive Assistance for Family Caregivers program provides veterans who have service-connected medical issues with access to the care they need. According to the U.S. Department of Veteran Affairs, the Program of Comprehensive Assistance for Family Caregivers applies to veterans who meet the following requirements. Veterans may be eligible for this clinical program if they sustained or aggravated a serious injury or illness in the line of duty in the active military, naval, air service during any service era. Among other applicable eligibility criteria, an eligible veteran must have a single or combined service-connected disability rating by the Department of Veterans Affairs of 70% or more, be in need of personal care services requiring in-person personal care services for a minimum of 6 continuous months based on any one of the following: an inability to perform an activity of daily living, a need for supervision or protection based on symptoms or residuals of neurological or other impairment or injury, or a need for regular or extensive instruction or supervision without which the ability of the veteran to function in daily life would be seriously impaired. If a veteran meets these qualifications, the VA will compensate the caregiver's services for up to 40 hours per week. In addition, family caregivers may be eligible for training, health coverage, counseling, and other valuable benefits. In-home care for veterans in Minnesota. We are proud to have over 300,000 veterans in Minnesota, and many of them require home care resources due to physical or mental conditions. Personal care assistants can help provide this support. These trained non-medical professionals offer physical assistance, medication reminders, helping prepare healthy meals, and companionships. PCAs can also receive special training to work with individuals with PTSD or TBIs so they can keep a close eye on symptoms. If you find this podcast helpful, share this with a friend, leave a review, and don't forget to subscribe. Contact us today for expert guidance and support. Visit bestcaremn.com. Thanks for listening to the Caregiver Connection.